Hey, Dr. Rob here, Facebook Live. We're going to be talking about infertility. So everybody do me a favor. Please like, share, comment. Let's spread this out. There's so many questions. I just did a talk last Tuesday in South Dakota. Wonderful city, wonderful state. Had a great time. So much interest. I'm answering so many questions via Facebook, Instagram, and email that I wanted to share this with everybody out there. So I want to share some breakthroughs in the natural approaches to infertility. What contributes to infertility? Well, I got my little sheets here. There's such, unfortunately, a long list that I want to share all the different things that can lead to infertility. Number one, poor nutrition. It always comes back to the same thing. It always comes back to diet. We need to eat a good diet. You want to eat a chemical-free diet. You want to eat a more organic, farm-to-table type diet. So poor nutrition, high sugar, which we're going to go into, poses a tremendous, tremendous problem. Number two, emotional stress. Stress is deleterious to everybody's health. Stress, unfortunately, damages everybody in a multitude of ways. A lot of times when you have stress, you have a release of cortisol. Cortisol is not a great hormone. It's not going to be advantageous to be able to get pregnant. Sexually transmitted diseases, chemical or environmental chemicals. Environmental chemicals are huge. It's a major, major issue. We live in America. We have more chemicals that are used in America than the whole world combined. I think in 2012 there was a study that showed it was 3.63 billion chemicals shared on our land, in our air, and in our water. It's just horrific to think about how many chemicals environmentally that we've been exposed to, and they're adding them all the time. The growth has really been from World War II on. So these environmental chemicals are a major, major issue. A lot of these chemicals cause the inability to get in vivo and in vitro implantation in pregnancies. So even if environmental chemicals are not your concern for pregnancy, they should be your concern overall for health. So obviously we're going to talk in a few minutes about detoxification. Candida, that's a yeast in the gut. So of course gut health is a critical element. Always want to take care of your gut. 80% of your immune cells are in your gut. It's where your macro and micronutrients are. Every week I can do a Facebook Live on the new information that comes out about gut. So, you know, the gut-to-brain axis, all these type of things. And I'm going to do a special Facebook Live coming up at the Florida Chiropractic Association this week on Thursday and Friday and Saturday. We're going to do a couple of Facebook Lives on that information. PCOS, or what we call hormonal problems, a lot of insulin resistance and inflammation. So those hormonal problems come from that insulin resistance. So let me describe what goes on, and you'll see why as we succeed through this talk. We're going to talk a lot about blood sugar and detox as your main two tenets on how to fix it. What's going on with the insulin resistance is that when you eat too much, your blood sugar goes too high. So what happens, you spill too much insulin, and the insulin pulls you down, pulls your blood sugar down to almost like drag. So cortisol then comes out, and cortisol tries to offset what insulin's doing and brings your sugar back up. Ultimately, when you spill enough insulin, you're ultimately going to become insulin resistant. So insulin resistance or prediabetes or for type 2 diabetes are a major, major issue. Very common in the American diet. Some of the bigger problems on insulin resistance or leading you to insulin resistance is the high level of sugar that we consume. The average American consumes 160 pounds of sugar per year. In addition, 15 to 20% of our whole caloric intake comes from high fructose corn syrup, which is now masked as fructose. So we're having a sugar issue. Hence, when we have a sugar issue, leading us down a path of insulin resistance. Excessive exercise. Now, most Americans don't exercise excessively, but people who are doing, triathlons and long swims, Olympic level athletes, sometimes that excessive exercise does not allow you to get pregnant. Finally, obesity. So most Americans are obese or overweight, in that the average American now perceives somebody who's thin as 10 pounds heavier than they did a decade sooner. Obesity or fat cells, or larger fat cells, corpulent if you will, fat cells are depositories for toxins. So all these toxins are in the fat cells, and they're stored and they're floating, and these toxins are not enabling men and women to have children. Unfortunately, and please, I hope this is politically correct, Ultimately, if there's an issue, it still always falls burden on the woman, so we have to do something with the woman for the simple reason that the woman carries the child for the 9-month period. In addition, foods that can negatively impact fertility. There's specific foods that I would strongly recommend that you avoid, and here they are. There are high processed meats, because these high processed meats are very high in inflammation because of the additives that are used. So no processed food if you're thinking about getting pregnant. In addition, grains. Believe it or not, grains are questionable if we should eat at all, but grains like a rice or anything increase cortisol. Refined sugar. As I said earlier, sugar, the average American consumes 160 pounds of sugar per year, which is almost a half a pound of sugar. What they found out, if you consume 75 grams of sugar, which is about 300 calories of sugar at a meal, it decreases your immune system for 2 hours. So your immune system is shut off for 2 hours after a high carbohydrate, high sugar meal. So think of all these things that can occur 2 hours. If you were protecting the United States, would you want our nuclear defenses to be shut down for 2 hours? Because your immune system is your nuclear defense. In addition, booze, alcohol. People say they only drink socially. I always ask in my book, Inside Out Health, how social are you? Alcohol increases inflammation, decreases immune function, and increases ovulation disorders. And finally, caffeine. I'm a big proponent of having a cup of coffee, tea, 1 to 2 a day. I think coffee, especially organic coffee, is a great choice. But the coffee and or the caffeine in the coffee can cause hormone disturbances. Finally, infertility by the numbers. When I read these numbers to you, you're going to sit back and just be like, wow. I mean, that's all I can think about. That's the one word that encapsulates how I feel. Wow. From women, 15 to 44 in this study, 12.3% have impaired ability to get pregnant. Over 6% were deemed infertile. 69 million women in America have used at some point infertility services. Now, 20%, 1 in 5 of women over 35 are aiming for their first child. 25% of infertile couples have more than one factor contributing to infertility. 40% of the couples, they found out, it is on the male counterpart. So the male obviously plays a major role with this. 13% of infertility is caused by smoking. Don't smoke, no sugar, no processed food, and of course avoid gluten. 25% of women have abnormal ovulation, and 1/3 of the women now are having their first child after 35. So when you look at the fertility protocol for all the things that we mentioned, let me go over this. So there's a lot of people coming in. We've got some fertility experts in the building, and a lot of people are coming in for fertility or natural approaches to fertility. The biggest thing that you're looking for in fertility, if you want insurance to cover it, is to take down their BMI. That's body mass index. I'm not a body mass index proponent at all. Body mass index is height over weight. I'm more of a body composition person, but right now you need to be 30 or under really to start for the fertility or the medical doctor fertility experts to help you. So you need to drop some weight and get your BMI down. So here we go. Here's my suggestions. Limit processed carbs. As everybody, no gluten, no processed food, no sugar, no dairy, no nicotine, no artificial sweeteners. Avoid trans fats. Fats are fine. It's just trans fats that are a problem. Fats are your friend. They are not your foe. So clearly eat, if you can, unsaturated fats. There are some saturated fats that are really good. It's trans fats that you want to avoid. Eat plant protein. That's the big thing now. We really want to avoid red meats. Now let me substantiate that by saying red meats that are grain-fed. You can have grass-fed red meats, but everything is now plant protein. It's great. Pea and rice, great choices. Let me flick this over. We got some more good stuff to share. And here we go. The continuation of the female fertility protocol. Try and get females, if you will, get some folic acid and iron in there. Exercise. New study just came out that if you exercise 30 minutes, 4 to 5 times a week, great health benefit. Everybody, let's get moving. It's 15,000 steps a day. Avoid sugary drinks, limit caffeine. We kind of talked about that, and we talked about the proper BMI. So there's the problems. There's the issues. We talked about the numbers. I had them right over here. So let's talk about how do you fix it. I learned a long time ago you can't show that there's a problem without giving a solution. So here's your solution. Number one, 30-day detox. 30 days, not the 10 days that I've talked about, 30 days. I like a 1-month detoxification program. Now, mind you, within that, what do you want to do? You want to get rid of all these toxins. So there are fat-soluble toxins that are the issue. They typically get broken down in the liver. Unfortunately, and I don't want to get too technical, unfortunately, they're not able to get broken down in the liver efficiently. The liver is broken up into two halves, we like to call phase 1 and phase 2. If they're in sync, you take a fat-soluble toxin, which is stored, everybody already knows, in your fat cells, and they go through the liver, they're made to a water-soluble toxin. At that point, that water-soluble toxin is able to get to the kidneys and or the stool and be disposed with. Now, the problem is phase 1, or the first half of the liver, is moving too quick, and phase 2 is too slow, and you're not able to break down this fat-soluble toxin. So I'm a big proponent of specific nutrients for all the needed enzymatic reactions on both sides of the liver to enable you or your patient to break down these toxins and dispose with them. So with that, you also want to have a high green or high alkaline type diet, which will enable you to break down and get rid of the toxins. In addition to some of the detox protocols that we like, I happen to like different powders and different pills that bifunctionally allow you to modulate the liver to break down these toxins. Probiotics are a great choice. Also, a lot of fish oils, alpha-lipoic acid. One of the things in literature really growing, and I just saw another great article, is something called sulforaphane. Sulforaphane is something that you get if you were to eat raw broccoli and or chop the broccoli. Once you cook it, you damage your ability to make sulforaphane because you lose an enzyme called myrinase. So sulforaphane is a critical element because it actually helps with any kind of gut issues. It also helps with antioxidants, and it's going to help you through the pathways of detoxification. All the products that I use that I will recommend to you incorporate the upregulation of making sulforaphane. So that's your 30-day detox. I've done over 2,000 detoxes in the office. I would tell anybody, even if they're not concerned about fertility or infertility, everybody would benefit from a detoxification program, both in the spring and or in the fall. I believe spring and fall cleaning is the best way to go. So everybody should consider a detox program. 30-day if you're looking at infertility, at the minimum 10 days just to get yourself going in overall health. That 30-day detox for infertility is also going to be followed by a 60-day blood sugar protocol. We got to decrease your blood sugar. We're looking at 3 months to change all your hormones. We want to bring your blood sugar down. We want to help you deal with any kind of possible insulin resistance, any elevation to the blood sugar. So what do I recommend? Well, I recommend a whole bunch of protocols and products, things that have chromium, selenium, alpha-lipoic acid, fish oils, probiotics. We have a powder here that's got super starches that I think is outstanding. Up your fiber. Upping your fiber will enable you to make more good bacteria, and upping your fiber decreases your blood sugar levels. If you want to stay healthy, you want your blood sugar level to never go up too high and stay steady at almost the same level throughout the day. That's a critical element to help with infertility and overall health, and actually take a few pounds off over here. So 30 days plus 60 days, 90 days, great solid infertility protocol. All the docs went wild last week. Wanted to share it with you. Some other little key takeaways that you may not know of, have heard about, that will really make that difference in the breakthroughs in treatment for infertility natural. Number one, during your follicular phase in a woman's cycle. That follicular phase is the first 14 days in a traditional 28-day cycle. The recommendations to eat are nuts, seeds, leafy greens, eggs, wild fish. You want to avoid alcohol. These are foods that are very high in the ability to help you detox. And by detoxing, you want to get rid of that extra estrogen. Those first 14 days, you're estrogen dependent. Your estrogen is high. Then when you switch to the ovulation, which is something like day 13 through day 15, and again, that typical 28-day cycle, you want to consume leafy greens, wild fish, grass-fed meats, water. Avoid Java, your coffee, your alcohol, and your processed foods. You're looking for foods that are high in B vitamins, because at that time, you're looking for the foods that are high in B vitamins to help with the implantation of the fetus, or the embryo, if you will. Then the luteal phase, that's your second or your last 2 weeks of your 28-day cycle. In that, you want to keep yourself warm because you want to hold the temperature. Warmth has been shown to hold the pregnancy. So you want warming foods, soups and stews, so you really want to avoid raw foods or cold foods. So if you adhere to these diet plans within the 30 and the 60-day blood sugar, the diet is the same over that 90-day period. You're just switching the different protocol prior. Let me clarify. This is to help you get pregnant. This is once you're pregnant on how to eat. So I know we have some questions. Steffi was taking them down. Hopefully you found this quite effective. Hold on, let me answer all the questions that I got a couple of hands raising over there.
Okay, can chiropractic care help to get pregnant?
Can chiropractic care help to get pregnant? Boy, I thought you said, can the chiropractor help you get pregnant? That was a loaded question. So I'm going to pass on that, what I thought it was. Chiropractic care can definitely help you get pregnant because the premise of chiropractic care is to enable the body to function at its optimum health level. So good chiropractic, I'm not saying it's going to make you pregnant, I'm just saying everybody benefits from good chiropractic care and your body benefits from it also.
The next question is, do you think too much dairy contributes to infertility?
Yeah, okay, so here it is in a nutshell with the great question. I don't know if you heard it. Do I think that dairy or too much dairy contributes to infertility? Here it is. No gluten, we talked about, no dairy. So I was just having a discussion yesterday as I'm preparing for the Florida Chiropractic Association. The question of dairy comes up. So no dairy. I'm a big proponent of avoiding dairy if we can. So a lot of people find that an issue, so use your alternative milks as opposed to dairy milk. So alternative milks like an almond milk or walnut milk, and please be careful when you look to the alternative milks. When you look to these alternative milks, make sure there are no added carrageenan or guar gum and stuff like that. All dairies cause an inflammatory process just like gluten in your gut. So please avoid it. Doesn't matter if it's an A1 or an A2 cow for all you functional medicine people. And some new literature came out that even goat and feta cheese do stimulate, about 90% of them do stimulate adverse inflammation. So try and avoid your dairy. Remember, no gluten, no processed food, no sugar, no dairy, no nicotine, no artificial sweeteners.
Okay, another question is, how do I avoid these environmental chemicals?
How do you avoid these environmental chemicals? I mean, I wish I could tell you it was easy. The average American or average female is exposed to 168 chemicals daily, average male 85. So think about all your healthcare products. So at home, try and use more organic, non-chemical products if you can. Outside, do the best you can, and the best way to get rid of them, as opposed to avoid, obviously, don't walk in a field full of pesticides. Detox, fall and spring.
Okay, next question. Any suggestions post C-section?
Any suggestions post C-section? Great question. Not necessarily infertility. Obviously, somebody was fertile, but the question is great. The real difference is the bacteria on the skin when you get a C-section is very different than the vaginal flora. The vaginal flora is lactobacillus, which is a great flora to help build the immune system for the child. Staph, like a staph infection, is what you have on the skin. So your options post C-section is, if you have to have a C-section, ask the doctor to take a swab, and a vaginal swab, and put it on the baby, and if not, probiotics. Probiotics, even if you had a natural childbirth, there's nothing wrong with building the immune system from day one. It's a critical element, and we miss that.
How about the males? That's the next question.
Oh yeah, how about the guys? Did I forget about the guys? Well, the guys obviously are at least 40% implicated in this. The men take part in it. I wasn't trying to avoid the guys. Some of the bigger problems with the guys is low testosterone. It's the big thing. We should do a whole Facebook Live on low T. So my suggestion for those men, one, if they have low T, my suggestion is, again, the detox, blood sugar, get their weight down, and some supplements that have really I've used to help testosterone, like ashwagandha root, zinc, vitamin D. Nutridyne's got a great product, man. Ooh, great product called Tribustan. Outstanding. Coenzyme Q10 is great for the mobility and the motility of the swimmers. So these are some of the things, in addition to getting the blood sugar down and detoxing, your patient base if needed.
Okay, the next question, can you go into details on the protocols and where you can get them?
Sure, I'd love to go into details on a protocol. So a big 30-day detox. So my suggestion is, make sure I say this right, it's rsilverman.metagenics.com.
Yes, correct.
I got a great store right there. So here's what I would recommend you get right now if you need something. Number one, get the Clear Change Kit, the 28-day Clear Change Kit. That'll fit into your 30-day detox. Works like a champ. Take that Clear Change Kit, Spectrum, that's a 30-day probiotic. You mix those together, you're going to do great for your detoxification. Comes with a guide and all those other things. 60-day blood sugar protocol, here's my suggestions if you're writing this down. Go to my store, Ultra Glucose Control, get 2 packets. So 2 packets at 30 packages or 30 packets each, so that you'll be able to take a shake a day. You mix that with something called Insinase, twice a day, and get alpha lipoic acid or metalipoate 300. You take those 3 things, you're going to bring your blood sugar down with a diet.
Okay, and then just the last question, does your gut health play a role?
Does your gut health play a role? Your gut health plays a role in everything because, as I've said before, 80% of your immune system is in your gut. You know, we referred to sulforaphane before. One thing about sulforaphane that made it so important, and you could add a little sulforaphane, I'm sorry for the oversight over here, it's called Sulforaclear, so you may want to get that. The sulforaphane actually now was just shown August 4th to enable the decrease of gut permeability, or what we call gram-negative bacteria, endotoxicity, and help with the gut-to-brain axis. More so than that, the gut is a critical element because if you're inflamed, you're not going to be as apt to get pregnant. So the final thing that I would say after all these, if this doesn't work and you're a practicing doc, fix their gut. Any more questions? Any shout outs I need to do?
No, that's everything.
Terrific. So let me get this straight because Steffi told me, if you like, please do me a favor, like it. Add some comments. We will answer. Any questions we will get. Share this. We need to share this information. This is something that's very personal to a lot of people, but a lot of people are finding it very informative. Please do me a favor, share it. Don't forget, if you need the protocol, it's rsilverman.metagenics.com. Click on what you need. Every Tuesday at 2 o'clock, Dr. Rob. And don't forget, got an Instagram going now. Steffi's all over it. It's drrobertsilverman.com. See you soon. Dr. Rob, always yours in health.